Why does Medicare have to be so confusing? Well, it's run by the government, so there's that. My name is Ed Weir. I ran the third business Social Security office in the country, and now I'm here to help you get everything you paid for from all things Social Security, disability, retirement benefits, survivor benefits. And today we're going to focus on Medicare because that is a confusing system as well. There's a bunch of stuff about Medicare in the news. So I've got a couple of experts here from Chapter. I've got Alyssa and Felix is going to help us go through navigate the bureaucracy and make sure you get everything you earn, save as much money as you possibly can, make sure you're in the right Medicare plan because it's all about your money and your health. So we're here to help y'all. How y'all doing today?
Doing good, Ed. Thanks for having us.
Yep.
Yeah, happy to be here.
Alyssa was here last time a few months ago. Felix is first time with us today, and Alyssa's in charge. What particular department at Chapter are you in charge of?
Great question. I run Chapter's member success team. So we help people actually utilize their Medicare plans and make the most out of their benefits after the advisory team, which Felix helps support, matches them with the right plan.
Yeah, that's a people can use if I always say if you have a high school friend or a nephew or son or whatever the case may be doing Medicare insurance, then obviously that's the person you're going to use. But a lot of those individual brokers out there, yeah, are spend a lot of time trying to get new clients in, and they have a difficult time doing kind of the after service. That's one of the reasons I
Yep.
partnered up with Chapter is to help with the after service. Yeah, because once you enroll in a particular plan, that doesn't end the whole thing.
It doesn't. No, yeah, then you got to use it.
Yep. All right, Felix, what do you help people with?
I am a sales manager, so I help a team of advisors, best in the business. We've really combed America for the best Medicare advisors to come work for us here at Chapter. So I have a team of 13 folks that's part of an entire advisory of sales folks. We have about 57 that are on the phones that help people. But yeah, I just kind of help them with their day to day. I answer questions. I also get on the phones when we are busy and help our clients and help people that have questions. But just proud to be here to represent our team.
Perfect, perfect. Yeah, and yeah, a lot of people need help because yeah, it's people spend their entire life doing their job, and then they turn 65, and it's like, okay, well, now I got to learn essentially a new job of how to navigate the bureaucracy. Okay, so this is and this is also a live Q&A, so it looks like we already got a bunch of questions already. But I've got some questions kind of lined up from people that are requested I answer during the other lives. All right. So number one is we are in the midst of a Medicare open enrollment period, OEP. Felix, what is the Medicare open enrollment period we're currently in?
Yeah, so it started back on January 1st, and it runs through March 31st, so the first quarter of the year. Anyone that has a Medicare Advantage plan in place can make a change to their plan. I look at it as a disenrollment window. So if they made a change back in the annual enrollment period and they don't feel comfortable with their change or things have changed pretty suddenly, and that can happen, they can make a shift and come to us and we can find a plan that works best for them now. Um, Also, you can disenroll from an Advantage plan and go to a prescription drug plan, which gets you back to what we call original Medicare. And that allows you to potentially get onto a Medicare supplement if you can pass underwriting that's required in your state, or if you're in a state that does not require that at all. So there's lots of different options. But I look at it truly as a disenrollment window where you can disenroll from your Advantage plan to go to a different one, or you can disenroll from your Advantage plan and go back to original Medicare and a prescription drug plan.
Yeah, that's one of the interesting things that people say. Well, my purpose is not to get out of the Medicare Advantage to go to a Part D plan. My purpose is go to a Medicare supplement plan, but that's part of the bureaucracy. In order to get out of the Advantage plan, you have to enroll in a Part D plan, and that frees you from the Medicare Advantage plan, right?
Correct.
Yeah, it's all too confusing. All right, and let's see here. Leonard, already got hello, Dr. Ed. Just talked to Keith W from Chapter, and he set me up with a Plan N. Thanks for all you do with the help. All right, do you know Keith there?
Yeah, Keith Wesley is again one of those top Medicare advisors in the country that started with us back right before AEP, and we're excited to watch him grow this year. He's done a lot of great things for us. Glad you got to
Awesome,
talk to
awesome.
him.
Good deal. Yeah, yeah. Full disclosure, I always recommend everybody that watches to always, 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 if you're looking to sign up for Medicare, always check out a Medicare supplement plan first, a plan N, a plan. I prefer plan N because I'm cheap like that, but either one of those is fine. A plan N or a plan G. Um, and at least evaluate it first. A lot of people some people choose not to because of the monthly premium, and then check out Medicare Advantage. But always start with a Medicare supplement and see if that's right for you. If it's not, then Medicare Advantage. And either one of those is better than having nothing and just having original Medicare at all. Because if you have original Medicare at all, unless you've got a few $1,000,000 under your mattress somewhere, then yeah, you're going to be in deep trouble there. All right, so they can switch from a Medicare Advantage to another Medicare Advantage and back to original Medicare, but they have to go through underwriting. What's the whole underwriting process? What's that like?
It can sound kind of scary, right? But we have experts that take place. We're going to ask you specific questions if you've had cancer in the past, if you have any heart issues, if you're diabetic and use insulin, or if you have any upcoming physical therapy or procedures, really anything pending or things that you've dealt with in the past several years. We're going to ask you about it. We're going to ask you what kind of prescriptions you take. Those can be declinable depending on what they are used for and how often they're used. But yeah, we'll get to the bottom of it. We're not going to sign you up or help you enroll into a plan that's a waste of your time or that won't approve you. We ask those questions to get you in a plan that's going to save you money or protect you in a way. Like you said, if you don't have $1,000,000 lying around, you're exposed significantly to a 20% gap. But we do our best to sort of uncover every stone or look under every stone, I should say, and find the right plan for you.
Yeah, some companies for a Medicare supplement, they're a little bit more stringent than others. So if someone says something, oh, I had cancer 3 years ago versus 5 years ago, there's some companies that say, okay, if it's over 3 or over 5, they're good, but others not so much, right?
Absolutely, yeah. There's look back windows, and they vary carrier to carrier. Our team is so strong that if they hear that from somebody, they're going to know to rule out those plans that are going to have shorter look backs and just go ahead and look at the ones that are going to work best for our clients.
Yeah, and anytime you do it yourself, you can definitely do it yourself, but to navigate the whole thing. And how much do y'all charge for that help?
Our service is completely free.
Yeah, exactly, exactly. So that's what it's all about. All right. So Alyssa, getting set up on a new plan. So Felix and his team have found a new plan, a Medicare Advantage or a Medicare Supplement or whatever the case may be. What do they do then?
It's a great question, Ed. Like you said before, enrolling in a plan is sort of just the start, right? After that, you actually have to use that plan. You have to go to the doctor with it. You have to get your dental benefits set up. There's so much that still needs to happen after you're enrolled, and that's where the member success team really comes in. A lot of things that are important to think about this time of year if you've changed plans going into 2025 is to make sure that you update your information with your doctor's offices, your primary care physicians, all of that really good stuff. One of the things that Felix and our advisory team do incredibly well is make sure that any of your really important doctors, the people that are most important to your health care, are covered by your new plan. But you still need to make sure that they know that there's been a change to your insurance and your carrier. After that, you want to start thinking about prescriptions. When are those prescriptions due? Let's make sure that all of our information is on file. If you have to go through maybe a prior authorization process for your prescriptions, it's important to get ahead of that so that by the time those are ready for pickup, you don't have any surprises.
Yeah, perfect, perfect. Here's an important one. So let me answer this one real quickly since it's in the news and a lot of people are really freaking out there. Stacy asked, I heard that Trump is putting a freeze on Social Security. Is this true? No, it is not true. There was a couple of page document went out there that is going to freeze federal funds to a lot of organizations, states. But Social Security, Medicare is not one of those. Even Medicaid, but there's a little gray area there. But no, Social Security is still good for now. There's, a lot of federal employees are kind of freaking out. Like right now, they're, returned to work, which is fine, but that's going to reduce customer service. I guarantee it. I've done a few videos on that and explain why that happens. All right, Patricia asked, if I switch supplement companies, does my annual physical date remain the same to get a no deductible physical? Either one of
Well,
y'all?
you're sure, yeah, you're entitled to that Medicare's that $0 medical physical once a year. So your date should not change, but it's not going to reset. You get that one time per calendar year. It's got nothing to do if you switch your supplement and save money, which by all means call us, we can help you. Um, you get that one time $0 medical physical.
But it's yeah, they call it a physical, but Medicare physicals are,
They're limited. It's not
yes.
a full physical.
Yeah, yeah, it's not a full physical and stuff, but, yeah, it's kind of a, "Hey, doctor, how's everything going?" and kind of thing, right? But, yeah, they should really
Yeah.
expand those, but, yeah, but it also depends whether you have a Medicare Advantage plan and maybe they have some extra services there as well, right?
Right. Yeah, I mean, you're exactly right. They're just gonna kinda poke and prod you a few times and send you on your way. They don't do a lot of the important testing. With those Advantage plans, you're entitled to all kinds of tests that are preventative that are $0. Just look into your summary of benefits and find out what kind of tests you can get. But with the supplement plan, as long as that doctor accepts original Medicare, make your appointment. You may have to meet your deductible, which is small as $257, but you can, kind of get what you need done. Take
Right.
care of yourself, get ahead of things before something pops up that you don't want surprises.
Exactly, exactly. All right. So prior authorizations, we hear a lot about this in the news, and unfortunately for it, yeah. But anyway, how to navigate prior authorizations. So, Do you have prior authorizations with a Medicare supplement plan, a plan N, G, or F? No, right? No,
No,
no prior authorizations with Medicare supplements, right?
correct.
So we're only talking about Medicare Advantage. So Alyssa, you want to talk about prior authorizations and what y'all do to help people navigate that?
Yeah, absolutely. Prior authorizations in the Medicare Advantage space can be a little bit frustrating because it takes a lot of coordination between your carrier and the doctor's office. And as you would imagine, there's people actually, pushing paperwork and buttons, and oftentimes maybe don't exactly know what they should be doing or what they should or how to get the process done most efficiently. I think that's actually one of the things that makes the member success team the most valuable here at Chapter is we've dealt with hundreds, if not thousands, of prior authorizations from these carriers over the years, and we've truly understood the best way to get them done efficiently and get people an answer as quickly as possible. Oftentimes, that means us stepping in, calling doctors' offices, calling um, carriers on behalf of our members to make sure they get done quickly and properly the first time.
Perfect, perfect. On another question here from Charles on Part C, do you still have the Part A and Part B deductibles and still have to pay Part A and Part B premiums? So, Felix, number one, what is Medicare Part C?
So Part C would be your traditional Medicare Advantage plan that replaces your right to original Medicare. Um, it's a two-part question. So those deductibles are sort of built in, and we'll talk about what a maximum out of pocket is here in a moment. But you should be entitled to premium free Part A if you've worked the right amount of quarters. Part B premium is still going to be deducted from your Social Security check if you set it up that way. So yes, you are still obligated to pay that. Most of these plans are going to have what we call a MOOP or a maximum out of pocket. Those can range from anywhere between $2,000 all the way up to $10,000 depending on your plan. That's one of the first things that we look at, especially if you're going to go to the doctor a lot or have a lot going on. We want to keep that number low. Once you reach that number, essentially everything after that, if you're going to doctors that accept that plan, you don't have anything else out of pocket. So we're going to try to keep that number as low as possible.
Okay, perfect, perfect. All right, let's see. Concerned Sunshine says, concerned about your recommended supplement Medicare G instead of Advantage Medicare. what's the dollar comparison? How much will be taking from my monthly check in both examples? Well, yeah, if you have a Medicare Plan G, those do have a premium. You have to pay for those. The no prior authorizations and the no networks. Unfortunately, there is a cost for that, and it really depends on your particular state. But most Medicare Advantage plans have zero premium. So on either of those, you still have to pay your Medicare Part B, the $185. But on a Plan G, you have to pay for the monthly premium for Plan G or a Plan N or a Plan F. And then you also have to get a prescription drug plan, a standalone prescription drug plan. The prices of prescription drug plans this year, Felix, are going up, going down. What are you seeing happening this year?
And it varies across the board. I've seen some that are 0, some that are 50 cents, some that are $100. It really depends on which medicines you're taking. We're obviously gonna try to keep that premium low if you're not taking anything, but you need to have one in order to prevent any type of late enrollment penalty. But sometimes it makes sense to pay a little bit more in premium if it eliminates the deductible or it keeps your copays low. But that's our job to look at that stuff and find out which one makes the most sense for you. So we're gonna collect your drugs, your dosages, do a search in our system and determine which carrier and which plan makes the most sense for you. But it varies widely across the board. I've seen, like I said, 50 cents all the way up to $92.
Yeah. It's crazy when you look at the drugs, you're trying to find prices on drugs and you find one that has like a capsule versus a pill, and I guess it's the same ingredients and everything, but one is a liquid and the other one's a hard pill, and there's some of those things are like 3 or 4 or 5 times more expensive, aren't they?
It can be, yeah, the tiering can be all over the place. That varies as well. And again, we're going to ask you which pill or capsule you take and get that put into place to make sure that we make the right recommendation.
Perfect, perfect. All right. Let's see here. Alyssa, over the counter fitness, dental, vision,
Mhm.
hearing benefit, how to take advantage of all that once you're actually signed up.
Yeah. Another really important thing to do at the beginning of the year so that you can take advantage of those benefits throughout the entirety of 2025. One thing that we see will often happen is people have their Medicare Advantage plan, are excited about a certain benefit, but it's not always clear how to actually utilize that benefit. Who do you go to? They'll use, third party carriers or other things to actually um, give that benefit to their members. It's not always easy to understand how that works. The best thing to do is if you're a chapter member, obviously come to the member success team because we'll tell you anything and everything about how to utilize that benefit and make sure that you have everything you need, whether it's an OTC card or online access to take advantage. Now, if you don't have that, you can reach out to your carrier and they should be able to provide you some information. There will also be some information in your summary benefits and other things. Just keep in mind you want to make sure that you set those benefits up early so that you can take advantage of them throughout the year.
Okay, perfect. Yeah, the CMS, Center for Medicare and Medicaid Services, they still mandating those mid-year, hey, you've got these benefits available letters that are supposed to be going out in June or July.
I believe they are, but Felix, fact check me in case I'm misremembering. Last time I heard.
Yeah, last time I heard they were as well. So you can expect
Yeah.
Okay.
those.
All right, but we'll have a new commissioner of CMS coming, and
Yeah.
so things might change. So basically, what it was is, I think that was part of the Inflation Reduction Act on the previous president. He said that one of the problems with people on Medicare Advantage is they've got all these benefits, but they don't use them. And then says, these companies are being reimbursed, kind of, or being paid for these kind of extra benefits, and it comes out of the money you paid in FICA for all those decades. So it's your money, so go get your money. The over the counter fitness, dental. It's these companies aren't giving you anything for free. It's basically when you enroll in their particular company, whichever one is best for you, then those guys, in their $10,000 suits, go to Washington D.C. with cup in hand and say, "Hey, we just signed up Wanda. Give us the money that she paid into FICA all those decades." And so that's where the money comes from. So it's basically you just getting your money back. So, but the problem is a lot of people, they have, $1,000, 2,000, $3,000 of a dental. They haven't used it. They haven't used their gym membership, their transportation, their over the counter grocery card, whatever the case may be. And either the companies are making it difficult or they're not letting people know they're available. So that's where the whole thing about in July, as of right now, I haven't seen anything change yet, but as of right now, you're supposed to be getting a letter in July that says, "Hey, you've got dental benefits available. You got gym membership." Everybody forgets going to the gym after you usually the New Year's resolution lasts from January 1st to about January 7th or something. So stay away from the gym for the first couple of weeks, but then you can go back, right? But yeah, so hopefully the letters still go out. But with Chapter, y'all don't need the letters. Reach out to Chapter if you're one of their members, and they will say, "Hey, oh yeah, you've still got dental, you've still got this, you've got a gym membership," and they will help you navigate that process and get what you paid for, get your money back, right?
Yeah.
All right, speaking of those grocery carts, either one of y'all, because this is a big thing. Are I get this question all the time. Do they exist? Or is it just, social media, um, internet clickbait, internet myths?
So I'll take it. They exist. I think that some of the advertisements that are out there are a little bit exaggerated or maybe misleading, and that's typically how the internet goes.
Way
Yeah.
exaggerated.
Right. Well, it's yeah. I'm being kind. More often than not, you're going to find grocery benefits and add-ons into plans that are for folks that have Medicare and Medicaid. We call those dual special needs plans. They are not included in all plans. Very, very rare to find that. But for people that have Medicare and Medicaid, a lot of times you can make a choice, or you can have that additional spending to get healthy foods like meats, vegetables, certain things like that, dairy. Um, but they exist. But a lot of what you're seeing out there online is, like we said, greatly exaggerated.
Yeah, yeah, I always say it's like, you call here and you can get, $500 a month and free ice cream for life and unicorns and yeah, so they just come on, people. And it's kind of a kind of a switch type of situation where you call them and they take the best grocery card in the country, and one particular zip code in West Virginia that has incredible benefits, and then they advertise it to the entire country, and everybody in the entire country calls and they say, "Oh, if you don't live in West Virginia, oh well, sorry," but then they do the whole hard sell and try to sell you on something else, right?
Yeah, you see that across the board, and it's frustrating because we know that's happening to people. But if you feel like you're entitled to more, you want to see that, give us a call, and we're happy
Yep,
to look at that
perfect.
with you. We're not gonna leave anything off the table for you.
Perfect, perfect, and it really depends on what's available in your particular area. What's the cheapest supplement? Plan N?
It depends. I mean, there are high deductible plans that have a much lower premium, but if anything happens, you're going to be responsible for that high deductible, and that cost savings can go away in a hurry. Plan N is typically always going to have a lower premium than a Plan G, but you're going to be subjected to copays. So what I tell people is, if you're healthy, go for it. However, those copays can turn into a snowball rolling downhill really quickly. If you have to start going to multiple doctor's appointments, that savings in premium, which can be 60, 70, 80, sometimes $100, can go away after just a couple of appointments because those copays are $20 every time you go to a primary or a specialist. And it can be $50 if you go to an emergency room. So, buyer beware with those. They're awesome plans if you're healthy, but we always typically start with the G and we explain why.
Yep.
But N is
Yeah.
good for a lot of people.
Yeah. I'm cheap, so that's why I do an N, and I just it's
Yeah,
one of those. I'm optimist. Hopefully I don't get sick, and yeah, hopefully I
yeah,
save enough money over the years, not having to pay any of those, and then it works out in the end. But
yeah.
you never know. Yeah, G is definitely the simplest one to understand. Absolutely. My formerly $25 drug now costs over $150 not covered. Alyssa, what would you recommend someone in that situation do?
Yeah, it can be tough. Really want to talk to an expert, someone who can look at what is the drug? Is there anything we can do? Can we get a formulary exception, something else? Is there anything that you can do with your plan? Beyond that, there are some great websites out there that are looking to reduce the cost of drugs. GoodRx is a great one. You might be able to take advantage of some of those platforms to reduce that cost, but really depends on the specifics. That's why you want to talk to someone who knows, whether that's someone here at Chapter or if you want to reach out to your carrier directly. They might be able to guide you in the right direction, but you might have to really push and advocate for yourself during that conversation. So keep it in mind.
What's a formulary exception? How does that work?
It's a really great question. So, based off of every drug plan is going to have prescriptions that are covered on it. However, if you're on something that maybe isn't on that list, you in conjunction with your doctor can see if the plan will actually cover the cost of that drug. Doesn't always work, but it's often something that you can try.
Okay. And that's the same thing. So yeah, it's same thing with Social Security. If you get a decision you don't like, I always recommend people do an appeal, SSA
Yeah.
561, then do an SSA 501 to see the administrative law judge. So any type of thing like that, you have an appeal. So if they deny they increase your price, you can get a formulary exception. If you have a prior authorization that is denied, if you have a Medicare Advantage, appeal because the idea is to deny, and then most people just kind of give up. But the success rate for people that fight back, that challenge the denial, is pretty darn good, right?
Yeah, it's always worth appealing a decision if they come back telling you no. Can also be helpful to really coordinate with your doctor. Make sure that they are making a strong case for why you need, that drug or that procedure. Can be really helpful.
Perfect. All right, another success story. Hello, Ed, Alyssa, and Felix. I signed up with Jacqueline Green at Chapter, who was amazing and professional. Thanks to you, I was able to get a supplement G and a drug D, and I have recommended Chapter 8 to others. Awesome, good deal. Yeah, that's one of a lot of people miss is when they sign up for a Medicare supplement plan. They say, "Oh, I don't need a deep." I don't, when they sign up at 65, "Oh, I don't take drugs, so I don't want a prescription drug plan." So, what kind of problems can they run into, Felix, if they don't sign up for a prescription drug plan?
Yeah, you'd be subjected to a lifetime penalty. And that's a scary word to think about. It can be a very small amount of money, but it's based off of how many months you go uncovered. So you just want to go ahead and do that. And like we talked about earlier, if you were in here, those drug plans can run you, they can be $0 or 50 cents. So if you don't take anything, that's what we're going to look at. But it's always about planning for what's ahead. So you might not take anything now, but that can change a month from now, a year from now, however long. So you always want to be prepared and protected.
Yep. Yeah, as I always say, there's, it's you have the freedom to do whatever you want. You're not mandated to take part, B or D, but the repercussions of not are the repercussions of not. If you refuse Part B when you're 65 and you never sign up for it, you're never going to get a penalty. Same thing with Part D. But if, life is what happens while we're making other plans, if you do sign up for it in the future, then that's when a penalty kicks in. For Part B, it's 10% for every 12 months you were supposed to be enrolled. And then Part D, it's 1% for every month you weren't enrolled in Part D.
Yeah.
Right. And they do some kind of weird formula, 1%, because 10% of the premium. So if it's 10%, it's $185, $18.50, easy. But the Part D penalty is, how does that whole thing calculate? 1% of what?
That's, if you give me one moment.
It's kind of the national kind of average of a
It's
prescription
based off the
drug.
national beneficiary, like the base premium. So and that can
Right.
vary year to year.
Yeah, I can never figure out how they do those calculations too. So yeah. So yeah, so they come up with a new calculation and said, okay, here's what the kind of the base premium is for this year. So if you didn't, then 1% of that. But hey, 1% doesn't sound a lot, but if you're 24 months late, that's 24%, right?
And that's the thing. Like if you don't know, a lot of people don't know. And you kind of hit the nail on the head. Like people will delay this because they're not mandated to take a Part D plan, right? and they'll wait 5, 6, 7 years, and they'll hear that their friend has this plan that's an Advantage plan that gives them $5,000 in dental and maybe a grocery card. You never know. And they sign up for it. They are still subjected to that penalty 5 years down the line. That's 5 years times 12. So that's that penalty of whatever that national average is at the time. And you're going to be, instead of paying a $0 premium for your Advantage plan, it's going to be whatever that premium, that penalty is.
Yeah. Yeah, people do the math and they say, "Well, I pay 0 for my Medicare Advantage, so 1% of 0. Oh, okay, I can deal with that." But yeah, that's unfortunately not how it works out, right? Let's see here. It says, Social Security specialist outstanding said to put premium surcharge rollback on top of application 40B and 564, then upload evidence of group health plan, applying ASAP, rollback chance. All right. So premium surcharge. So you were talking about probably a IRMA, income related monthly adjustment amount, being charged an extra charge for the Part B because based on earnings from 2 years prior. Yeah, that's premium surcharge rollback. I'm not sure that form is going to help you. The 40B and the 564 are the forms you submit to Social Security. That yes, you can upload them now. Social Security has finally jumped into the 18th century, and you can upload those documents. And that'll sign you up for Part A and Part B. And then the 564, that's the one that's going to prevent you from getting a penalty because you signed up after 65 because you did have health insurance from work and your employer had 20 or more employees and all that stuff. But if you're talking about a premium surcharge rollback, premium surcharge, then the only thing that's going to help you is the SSA 44. And that's the one that says you have a life changing event. Yeah, so it's confusing there. What does Plan N and G costs? Different throughout the country, right?
Yeah, it varies. Start with a G. It's usually going to be around 100. This is when you're turning 65 or new to Medicare. That's how I'm at this pricing. It's usually going to be around 100 to $115 in most states, and you can get discounting if you live with someone. A lot of times that person has to be a certain age to get a discount. Then most often a planning is going to be 80 to $90, give or take some discounts. You're going to see higher prices in guarantee issue states like New York because anyone's eligible. So those G's are going to be high 100s, low twos, more expensive. You're also going to see higher prices in Florida because there's a lot of retirees there. It's a fun place to live when you're done working. So those premiums are going to be just traditionally higher across the board.
But then in Florida, they have flying cockroaches. So there's that.
I don't know if supplements can take care of those.
Linda, I was told because of my pre existing conditions, I will never be allowed to have a Medicare supplement. What do you say to that? Could be a possibility, huh? It really depends on what type of pre existing conditions we're talking about, right?
Right. Yeah. I mean, and everybody's situation is different. You may have an open enrollment window where we don't even have to ask about your pre-existing conditions. So that's just why you need to speak with an expert to find out what we can do for you. You may live in a state like New York where they don't ask medical questions, or you may live in a state like Illinois where there are some tricks where certain carriers don't underwrite and you can qualify for a plan. It's just a matter of your situation, and that's our job to figure that out. So if you're
Yep.
looking and you're concerned, happy to help.
Okay. Yeah, and like California, there's a carrier there that sometimes does kind of a special thing where they don't do health underwriting during particular times. I know there was one last year, and
Well, yeah, so I didn't see it this year, and I was a little bit upset about that. United Healthcare offers an underwriting holiday, and sometimes Blue Cross Blue Shield does in California, and they will pretty much take anybody. But that's again, they've done it almost every year since I've done this, the past 8 years, and this year was the first time that I didn't see it. So I don't know
mm,
if they'll bring that back. I hope that they do. But it's like we call it an underwriting holiday where they will just if you want the plan and you want to apply for it and you have an existing Advantage plan or no coverage at all, then you can make the shift.
okay. All right. Let's see here. I got other kind of questions. Let's see. Alyssa, 2025 Part D changes. What type of tons of changes for Part D this year, right? The prescription drug
Yeah,
plan.
lots of changes. I'm actually gonna kick it to Felix because he can describe this much better than I can.
Okay, go for it.
Sure. Yeah. I mean, the biggest change is the donut hole went away. Um, and a lot of people will call us and ask what happened to it. Um, there's also, those caps on insulin's carried over. But essentially, there's a maximum out of pocket now on prescriptions, which is pretty significant. There's also plans that don't have a deductible, or you can find plans that have high deductibles, but the tiers ones and tier twos, like those common, statins and lisinoprils and things like that, don't count towards, so you can still save money. You're not contributing to your deductible. But the donut hole being eliminated is one of the most significant changes that I've seen in Medicare um, in the past decade. It really put people in a tough spot. Capping costs is a big deal, and I know it's been in the news lately. Um, but it's not changing for so you can rest assured for that.
Okay, perfect, perfect. Is this service free of charge? Yep, we've already talked about that. Yep, just call them up and got the number I pop up every now and then there. Just give them a call and say, hey, I've got a Medicare Advantage. I think I chose the wrong one. I forgot to check my Medicare Advantage because, yeah, if you didn't, there's a lot of people that their plans, there's a carrier that left the entire state of Missouri. There's companies that left particular parts of the country, they said, "Hey, in this particular, in the big cities, not usually not so much, but if you kind of live out in a rural area, out in the desert, out in the country, or something like that, there's a lot of those health insurance companies that said, "Hey, we're just not making enough money in this particular area," so they just said, "We're out of here." And I think last I saw was about 1.8 million people have lost their plans, and I hear every single day that people, they go into the doctor's office and the plan is canceled. They didn't get the letter, they didn't open the letter, they whatever the case may be. So it's important that you reach out to your health insurance company and make sure it's still active. Reach out to your Medicare insurance broker, reach out to Chapter and whoever, and yeah, make sure you're still good. Or if you didn't review your plan, Medicare Advantage, that's the one thing. If the a Medicare supplement is not for you, then Medicare Advantage is again, unless you got a few $1,000,000, it's the way to go. But it just takes more. It takes more work. When people sign up for a Medicare supplement plan, they're in a Medicare supplement plan pretty much forever, unless they want to save money. So if you're in a plan G or a plan N and you want to save some money, what can you do? Can you switch out of a plan
Yeah,
G to another plan G?
yeah, as long as you can pass medical underwriting, if that's required in your state, it's always in your right to shop. You don't have to shop during the annual enrollment period. That's a big misconception. You can always look to change if you're healthy enough, or if you want to take a shot at trying to save money on your premium. Then by all means, try. It's always good to save money.
Yeah, and the Medicare supplement companies, they usually come out. I could never figure out why this was the fact that they come out with the price increases like in March or something like that, right? Usually toward at the end of the beginning of the new year or so.
It depends on when you change. Most people are going to change in that annual enrollment period. It's just it's heavily advertised, and people will look to change then. Usually, uh, most carriers are going to have a 12-month rate lock, so your premium's going to stay the same for that first calendar year, and then that comes up. You're going to get a letter in the mail that says, "Hey, your premium was this, and now it's going to be this." When you get that letter, that's when you need to start trying to shop to see if you can save on your premium.
Yep. And depending on what state you are, you probably have to go through health underwriting if you're past your, 65 or new to Medicare, whatever the case may be. All right. What type of questions? I'm sure Alyssa, y'all's team is like super busy right now. What type of questions y'all are getting with all the changes? People kind of stressing about everything. What's your common
Yeah.
questions nowadays?
Yeah. One thing about the member success team is we tend to be incredibly, incredibly busy going into January as everyone is trying to figure out those new plans. Questions really vary, and the answers in terms of how easy or complex they are also vary. Um, Oftentimes, there's people who haven't gotten information like their plan ID card yet, and they want to utilize that plan. They have a doctor's appointment that they need to get to. So helping people kind of navigate the minutia of the U.S. postal mail and getting
Hmm.
accessing that plan is certainly something we see a lot of this time of year. Beyond that, it is a lot of making sure that people have what they need when they go to the doctor, when they're picking up their prescriptions, like we talked about before. Another thing that we see on the Medicare Advantage side is oftentimes people who are signing up for these plans, they're excited, of course, about the cost, but they're also really excited about a specific benefit. Maybe they've needed dentals, they've needed their teeth looked at for quite some time. They haven't been able to do that, and they're looking to take advantage of those benefits as quickly as possible. Again, going back to the fact that how to actually utilize these benefits is not um, advertised or shown really clearly. So it's good to talk to someone who knows exactly what they need, whether it's finding a dentist, making sure that that the procedure is covered, those sorts of things.
Perfect. And a lot of trick well, what people use is they if they have a Medicare Advantage with dental in there and they've got a lot of work they need to do, they get it
Yeah,
half of it done, the bottom
yeah,
the bottom half in December and the
it's
top
smart.
half in January, right? Yeah,
Yeah, yeah, it's smart. Make the most of what you have for sure.
right. Of what you paid for, because
Yeah.
again, the insurance company, that's not the insurance company's money, that's your money, you're just getting it back, yeah, so, at 65, can I get Medicare and not be penalized for income? I'll take that one. It really depends. You're probably talking about, again, the IRMA, the income related monthly adjustment amount for high wage earners. So if you start your Medicare at 65, they will look at your income for 2 years prior. This year, if you're single, you make over 106,000 2 years ago. If you're married, 212,000 over 2 years ago, and it's capital gains and withdrawals. It's different than the annual earnings limit for Social Security. They look at different things. It's called the MAGI, the Modified Adjusted Gross Income. Um, but yeah, so you might be charged the extra Part B premium. Again, it's based on your income from 2 years prior. But yeah, if you're signing up for 65, but one of the things that we want to make sure people do is not waste money and not get signed up for a Medicare plan if they don't even need it. So if you're turning 65 and you have health insurance from work, your current work, not a retirement plan, not the Affordable Care Act, not COBRA, but through current work. If you have health insurance through current work, yours or your spouse's, and your employer has 20 or more employees, that group health plan has 20 or more employees, then you do not have to sign up for Medicare Part A or Part B or any of it. You can, once you stop receiving that health insurance for, 5 years, 10 years down the road, then you have 8 months to sign up for Part B to avoid any penalties. If you want to sign up for Part A at 65, since it's zero premium, a lot of people do that. The only caveat there is you have to stop contributing to your HSA, your health savings account, 6 months before you sign up for Part A. So you can call Social Security and say, hey, I want A, only Part A. Don't sign me up for Part B. Don't start my money. Or you can say, I want Part A and start my money, but I don't want Part B. So you can restrict your application in several ways there. So, Karen asks, I am planning to retire in 2 years at 65. What plan should I apply for? What do you say?
Okay, and it depends on your situation, and we've helped figure that out. I mean, I always recommend the Plan G or the Plan N. That's what I'm going to recommend to my mom when she retires here in a couple of years. But it just depends. If that's within your ways and means, and that's what we're going to recommend. But we also have the ability to look at every single Advantage plan available in your area. So if that's going to be the better plan for you, then we'll get your doctors, we'll get your prescriptions, and we'll find out what you need and what's best for you, and we'll look at all that stuff. Um, 2 years will get here in a hurry, but it is also a ways away, and things can change in that window. But 6 months out from when you're planning to retire, give us a call, and we can evaluate everything you need us to. We can learn about you and get you in the right situation.
Perfect, perfect. Yeah, the worst plan is, the people say, well, my next door neighbor has this plan and they're really happy with it, and that's probably the worst plan right there because everybody's particular situation is different. Your next door neighbor might be super, super healthy or not so much, and they have different doctors and different needs and all the rest of it. So it's 100% individualized. Don't take anybody's recommendation on what plan you should take until they ask you a bunch of questions. So if you're 65, you're turning 65. What the silver tsunami is upon us, that what 11,000 people are turning 65 every single day. So those 11,000 people need to figure out whether they, number one, should they sign up for Medicare at all, or if they're good, they can put it off. But if they're going to sign up for Medicare, they call chapter. What do y'all do? What's the first thing you do once they call you for help?
Yeah, we'll just get to know you and your situation. We'll find out what kind of coverage you're used to, what you're familiar with, what you have going on, if you have any procedures or things upcoming, what you know about Medicare. We're going to educate you on how it works because it's all really new to you. It's our job to be that expert for you and be in your corner. But we're going to collect your providers, your prescriptions, and find out what your priorities are. We live on those three P's. That's our model. But it's important for us to know every detail about you in terms of your health to make sure that our recommendation is the fit for you. So it's really a little bit of everything. But if you have questions, bring them because we'll be able to answer them. And
Perfect.
you're gonna leave an expert like us.
I like it. I like it. Medicare Advantage does work. Robert says you need a good doctor to deal with the paperwork. Yeah, Medicare Advantage. Last I saw, 51% of Americans on Medicare are have enrolled in Medicare Advantage. A lot of people love them. Zero premium and all the rest of it. Yeah, it just does take a little bit extra work, and it sounds like Robert has an awesome doctor that does all the work for him. So that's pretty awesome. So good deal. So, but yeah, with anything like that, make sure you fight for your rights. It seems so easy for our government to cut a check for other countries. Oh, okay. Well, that's a Social Security check. Yeah, yeah. Asking for a family member. Thank you, Purple Love, for looking out for other people. If she has Medicare and a supplement insurance Part D prescription and lose insurance because she can't afford the premiums, can this person go to an Advantage plan? Either one. So loses, just can't afford the premiums anymore. A lot of people, unfortunately, yeah, this is a situation, particularly Plan F. The plan people in Plan F, because that pool is getting smaller and smaller and the price is going up. So a lot of people, just can't afford the premiums.
It's a tough situation, and I empathize with you because a lot of Americans are going through that. Um, First, what we want to look at is how much is that premium, and can you make a change to maybe save some money on your premium and get by that way? That's going to be our first path that we take. And if not, then we would need to look for what we call a SEP or a special enrollment period to look for if we're outside of a window to make a change for an Advantage plan. Losing the supplement due to non-payment is tricky. Or not being able to afford the premium. Never want to see someone lose their coverage because it gets become too much, it becomes a burden where you can't pay for certain things that are essential. But we would, like I said at the very beginning of this call, we're going to look under every stone for you to make sure that we can get you the coverage that you need. And it really just depends. And I know I probably sound like a broken record, but every single person that we talk to has a different circumstance and a different situation. And we need to talk to you to find out how we can help you.
Yeah, that's the reason I'm doing this whole channel now, is specifically on Social Security. There's 20,000 pages of Social Security policy, and each situation is a little bit different. Husband and wife filing for benefits at different times, and independently entitled divorced spouse and disability. So yeah, and unfortunately, Social Security is at a 50-year low in terms of staffing. So, and it's going to get a lot worse. It's going to get a lot worse here coming. So, Deborah, oh gosh, I'm in the middle of breast cancer in Texas. I'm not secure in knowing if I'll be able to continue with my Texas plan with medication, and I have Medicare, but Trump froze Medicare and Medicaid, so I don't know. Again, yeah, so I just want to make sure it's clear that the White House spokesman came out and said no, Medicare, Medicaid, Social Security is not part of that particular cease and of funding. So you're good there. I know there was each of the 50 states had a problem. The computer system was down, and the conspiracy theorists out there can have a field day with that one, but it was down for an hour or 2 hours. So the states couldn't get in there and get the funding that they need because Medicare and Medicaid are different. Medicare is the federal program that you sign up for, through Social Security Part A and Part B. Medicaid is a state program for people with low income and low resources. And there's a lot of people that Medicaid is an issue, and I think it's going to be continuing to be an issue going forward. Work requirements and the funding count stoppage and delays, and it didn't happen today or yesterday, but it I did a video on this about a week or so ago. It looks to be kind of the writing on the wall for Medicaid that some stuff might be happening. But in your particular situation, if someone has what exactly is let's start off with what exactly is a Medicare Advantage dual eligible plan, those D-SNPs. It's somebody with Medicare and Medicaid. So what do they do if they lose their Medicaid? What happens?
You typically get a bit of a grace window. I believe it's 30 to 60 days. It's tough. You'd be granted an enrollment window to change because you're losing your Medicaid at no fault of your own. Incomes change, rules change, regulations change. What we would do is we would again evaluate your needs. It's going to be very different because on these dual special needs plans, you're not used to having anything that costs anything. That's everything is zero or very minimal. But we would look for a plan that covers that your doctors accept, that covers your prescriptions and has a really low maximum out of pocket to allow you to live comfortably within your means, so you can sleep easy at night and continue your care in the right way. It's a significant change, and we see it all day, every day with people that are being reevaluated, and it's tough. In the way that we look at it is we want to treat everybody like they're our mama or our dad, and if that happened to them, we want to make sure they're you know sleeping easy at night. So
Yep.
we'll figure it out. It's not
Yeah. So
easy.
if they lose Medicaid, they just might lose their Medicare Advantage dual eligible plan, and then they have to switch to a regular plan because their dual eligible plan will be canceled. Yeah, yeah. What about Alyssa? You probably deal with a lot of people that get weird bills in the mail, and they say, "Hey, I have a Medicare supplement. I have a Medicare Advantage. I have this, that, and the other. What in the heck did I get this bill for?"
Yeah, well, the first thing you need to do is figure out if that bill should have come to you or not. Something that we see happen fairly regularly is people who are on supplement plans get bills just because their doctor didn't, bill correctly, right? And it's a relatively easy fix to make sure that that gets corrected. Other times, maybe you got a bill that you weren't expecting, but due to your type of plan and what is covered, it actually is something that you need to pay. In those situations, we can help you verify that information, make sure it looks right, and help figure out the best path forward in that scenario. Oftentimes, though, billing issues often come down to there was a coding error or something else. It's pretty happens pretty often.
Okay. So if somebody's enrolled through chapter and they get that weird bill, y'all help them figure out whether it's a coding area, whether they should just say, "Hey, this is kind of informational."
We sure do. Oftentimes, what will actually happen is we will just ask the person to snap a picture of what they're seeing so that we can look at it for them. And again, we will actually call the doctor or the facility on that person's behalf to get it corrected. That way, you sort of don't have to play the middleman. You don't have to try to describe something that can be sometimes pretty nuanced.
Yeah. Yeah, it's a nightmare. People hate being stuck in the middle between one insurance company and
Yeah,
the next insurance
right.
company, and the insurance companies just like to take it out on the person in the middle. It's like, "Hey, these other
Yep.
guys aren't paying, and so we're gonna harass you for
Yeah.
a while," and yeah,
Yeah.
it's
And so much of it is just, being able to speak the language of healthcare and, insurance carriers. That is not something that anyone should know unless you spend a significant part of your day doing it, which I hope no one does unless you're in the Medicare field like Felix and, my team.
Yeah, yeah, yeah. People spend their entire lives doing what what they did. My
Yeah,
dad was a long distance truck driver, so he could tell you how to get from one part of the country to the
right,
other and all the places to eat and said, "Oh yeah, stop at this place and say hello to Alice for me." And
right.
but in terms of all this stuff, yeah, it's Greek. If I have regular Medicare with the F plan, am I running the risk of losing that? I can't do Medicare Advantage, not with one of the medical issues I have. So people with Medicare Plan F, will they be losing that?
Oh, absolutely not. You're grandfathered into that plan. As long as you continue to pay your premium, then you're fine. It doesn't matter if you have any type of conditions that come up or any type of ailments. It's not going to prevent you from keeping that plan. Um, yeah, just continue to work with that. If you want to reshop and see if you can get a less expensive plan F, then you absolutely can do that as well. I know those prices continue to go up year after year. You can always take a look, but no, it's not going anywhere. It cannot be taken from you.
Yeah. What are the three pricing strategies, or not no strategies, I guess the methodologies they use for a Medicare supplement? The kind of there's three different ways they price a Medicare supplement: the initial rate and the birthday and all the rest of it.
I like issue like age issue, community rated. Um,
Exactly.
got it. That varies state to state as well. We get a lot of questions on that. You'll see those come up in seminars across the country, and I really I urge Medicare recipients and seniors to not get too bogged down in that stuff.
Yep.
It's all about finding the lowest premium because these plans are standardized by the federal government and picking the right plan letter, and then we can move from there. If you have questions about it, of course, but I think a lot of times there's analysis paralysis in some of these seminars that throw a lot of things at you when it's not as complicated as it's made out to be. It's not easy by any
Right.
means, but I usually try to get my clients and my team's clients and our in chapters clients to kind of put that to the side in the sidebar and look at the bigger picture of how much money can I save? What's this going to cost me? What's this going to look like for my care?
Right. Yep. And going forward, yeah, some states have those different kind of pricing strategies, and other states don't, and some do, but it doesn't really matter because the carriers basically only have the issue age pricing or the community pricing and stuff. So, and those because Medicare supplements, unlike Medicare Advantage are kind of federally regulated through CMS and everything. Medicare supplements are more locally regulated. That's why, like you mentioned in New York, Medicare supplements. Actually, if my personal opinion, I think every state in the country should be like New York. And if it was,
Mm.
then anybody can get into a Medicare supplement. Then the prices would go down. But the reason it's so expensive as in New York is anybody can pretty much get into a Medicare supplement. And because you get a lot of people that get sick in the other 48, 49 states, and then they move to New York so they get a Medicare supplement and get, whatever treatment. So New York has issues because they're the kind of one of the ones that are doing it kind of correctly. But that's my personal opinion.
Yeah, to simplify it as much as I can, I just tell everyone like the more often than not, the rates are going to be based off your age, your gender, and your zip code,
All
and we'll
right.
look from there.
Let's see, Reba, what kinds of information do I need to have handy before I call chapter? What do they need?
It's have your pen and paper ready because we're going to throw a lot of information at you, and we want you to have everything ready to roll when we're finished. But have your prescriptions handy. A lot of times you can just have your pill bottles and read them off to us. Have a list of your doctors. We're fortunate enough to live in a world where technology has come a long way, so you can sometimes pull up an app on your phone and have all your prescriptions and all your doctors in the palm of your hand, which can make things a little bit more simple. But yeah, doctors, prescriptions, and then we'll ask you questions to find out what works best for you and what you need, and then we'll go from there.
Perfect, perfect. I need help changing my plan. Who do I talk to? Call chapter. Call Felix and his team, and they'll help you out. I was told that my current plan I'm going to call on tomorrow. Okay, perfect, perfect. Um, can I claim mileage from original Medicare? I live 103 miles round trip to use Medicare benefits. Um, Medicare Advantage and transportation. Alyssa, what's that all about?
Um, yeah, so with Medicare Advantage plans, there are certain plans that will help you get to and from doctor's offices. Mileage itself is a really good question. I don't believe so, but I would have to double check and look into that.
Yeah, I've never heard of mileage on
Yeah,
that, but,
usually there's like a service that you can call and they'll help get you to and from the doctor's office.
right. I know that, because I was helping out one guy, he was living up in the upper part of Michigan. He was way out in the middle of, out in the hand, out in the fingers, and, there was no Medicare Advantage company that provided transportation over 50 miles.
Mhm.
I think that might be what he's asking.
Gotcha. Yeah. Hey, and the thing to keep in mind is, call, advocate for yourself, let them know what the situation is. And to your point earlier, Ed, if they tell you no, see if you can, escalate it, talk to somebody else. Oftentimes, being an advocate for yourself or having someone like Chapter who can help advocate for you, a lot can get done.
Okay. Have you ever done an exception to that where it's, oh, yeah, we can only take someone to the hospital or not to the hospital for regular visits as part of the transportation benefits. It's 50 miles. Have you ever done an exception? Come on, the guy lives 53 miles away. Can you make an exception?
Yeah. Yeah, oftentimes if you position and you're insistent, you, could put it through. Now, keep in mind, like, the decision is theirs. They're gonna say yes or no at the end of the day, but, we have seen exceptions made.
Okay, perfect, perfect. All right, let's do one or more questions, and then we'll call it a day. Tell us what to do if you still have insurance from work, having an HSA and not taking Part B, but signed up for Part A. Yeah, then in that case, you have to. It's not a Social Security issue. It's not a Medicare issue. It's a IRS issue, and I always avoid IRS. Um, when you have an HSA, a health savings account, then you're getting tax benefits from contributing that money. And then when you have Part A, then that you're no longer allowed to have an HSA. I guess you can have it, you just can't get the tax credits for it. You can have the HSA, you can withdraw money from the HSA, you can just no longer contribute. And because Part A is technically kind of when you sign up for Part A, it's kind of 6 months retroactive. So you have to stop your HSA 6 months before you start up for Part A. And a lot of people make that mistake, and they sign up for Part A because Social Security employees don't ask them whether you have an HSA because it's none of their business. It's an IRS issue. They really, I guess, should, but they don't really get into that type of IRS stuff. And from what I've heard is next year when you do your taxes, the IRS is going to send you a nasty little gram that says, okay, you owe us $13.50 because you had it for the 6 months. And so you shouldn't have got this $13.50 benefit. So it's not that big of a deal. It's not as though they're going to send you to Guantanamo Bay, Cuba or anything like that, or at least not yet. I don't know. But anyway, I'll keep an eye on Congress for that one. All right. I think that is it. I think we went through quite a few questions. I appreciate y'all joining us today. Hopefully, everybody were able to answer as many questions. And if you have any other questions, make sure you reach out to Chapter. Y'all are there working right now. What, 6 days a week, 7 days a week?
6 days a week now. We have a staff on Saturday. We're letting our team take a bit of a cool down on Sundays and enjoy times with their families. So we're here Monday through Saturday.
Okay. And then the member success team.
Also here Monday through Saturday. So we try to be available when people most need our help. Oftentimes that means on the weekend.
Okay. Perfect. All right. Hey, thanks for joining us. We appreciate it. And y'all take care. Have a beautiful day and take care of each other.